Earlier, in a dramatic turn of events, Lawal collapsed after concluding his introduction, causing several people in attendance to rush to his aid. He was, however, revived moments later. Though the Kaduna native was unable to take questions due to the incident, his nomination was also confirmed.
And I want to say that I am likely the longest serving inspector of the government in Nigeria. So I have been part of administration, I've been part of policy making, I've been part of trying to change things in the country based on what I did at the federal level and what I'm doing now at the state level.
Can you say water, give water. Water and sugar. Water, sugar. Get sugar, and water. Where is Dr. Wale? Can the camera cease immediately?
Let's also tell you that the public health sector has recorded yet another great feat in the fight against malaria. The World Health Organization has recommended a new vaccine known as the R21 by the University of Oxford, expected to be produced on a larger scale. How will the African continent, one that is worst hit by the parasite, benefit from this? Adesewa Odusoga reports.
Nearly 2 years after the world celebrated the advent of the first ever malaria vaccine, a new malaria vaccine has emerged, this time cheaper, and to be produced on a larger scale. This vaccine, known as the R21, produced by the University of Oxford, is said to be 75% effective and targeted at children, especially Africans, under the age of 5.
As a malaria researcher, I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have two.
The African continent has been largely affected by malaria, recording 234 million cases in 2021 and 593,000 deaths, accounting for 96% of the total death caused by malaria globally. Judging by the history of behavioral response to vaccination in Africa, the authenticity of these vaccines has also come under question.
Our health system is not resilient or robust enough to be able to deal with these medical conditions or this public health menace that arises. And because of that, you see high mortality. Yes, we know there may be one or two side effects, but you and I know that in public health, we are concerned about giving a greater benefit to the greater majority of the people.
The R21 is a 3-dose vaccine with more than 100 million doses to be produced yearly, expected to be rolled out in 2024 to some African countries. The protection of this vaccine is maintained for at least another year with the booster.
Out of 100 infants that take the vaccine, at least 25 of those infants may still come down with the parasite. Our projection, according to the World Health Organization, is that in the first year, we are going to see over 500,000 decline in the number of deaths or the mortality.
The R21 is the second malaria vaccine in Africa, after the RTSS introduced in 2021 by the pharma giant GSK, which has since administered 1.7 million doses of vaccine so far. At least 28 countries in Africa plan to introduce a WHO-recommended malaria vaccine as part of their national immunization programs. Adesewa Odusoga, reporting for News Central.